Hello, my name is Dr. Ali, and I wanted to talk about the backache issue. I find it very difficult, not from a doctor point of view, but also when I try to understand it from a patient's perspective, it is very difficult to manage. And also, it's kind of very evident from the researches as well, all the randomized control studies, that how difficult and challenging it could be, because it's all about the perspective of individual, that how it is or it is said to be effectively managed. When we talk about backaches, there are like sort of many reasons having backache. We will try to outline few of the main reasons. The first, and sometimes I would say more notorious, would be a sciatica pain, which is basically some irritation at the back of your spine, at the origin of the nerve, where the nerves are irritated, and that gives symptoms of backache, and that causes a shooting pain in the leg. That is one of the reasons to have a backache. The others are having a back strain. The uncertainty or the difficult part with the back strain is the people could suffer with the back strain for weeks to months, and sometimes you might not find out any finding on MRI as well, and that creates the uncertainty while we are managing it as well. The other things important to mention are having any trauma, for example, hyperextended back while working or hyperflex back. If there was any direct injury, if you've landed in a kind of a posture from a quite heightened place, chances of having a spread of cancers, for example, prostate cancers to back, or breast cancer to back, or sometimes bowel cancer as well. The chances of having infection. So it is kind of very complex in a way. There are like a lot of reasons to cause back pain. Sometimes people can be lucky. It can get better, for example, in weeks. But I think from the practice, what I see is most of the time it could stay for a longer duration as well. And that's where it's important to discuss the expectations as well. If I am a patient, I would also think that, if I've got some problem, I need to find out the reason. And I would try to get a scan. And in this case, I'm thinking about an MRI scan, which is basically a scan through a big tunnel. Now, is it really beneficial as per all the statistics? And the answer is otherwise. Most of the time, the MRI scans might not be beneficial in improving the pain as per the statistics, but it can increase the pain index and also be the reason of increased procedure and interventions at the back. With the studies, it's also been seen that we might find changes at least in 30% of the cases, which might be normal, and that changes might not be the reason for actual pain and could lead to unnecessary procedures. So it's a big debate in our society, especially in the UK, where we're talking about whether trying to meet the expectation, whether it is something possible at the primary practice. And as far as my understanding, GPs can't request an MRI scan for a backache, but also once the patient has been referred to a musculoskeletal hub or an orthopedician, it is at their discretion. But the chances of having an MRI scan for every backache is thin. They definitely arrange these scans, but it depends on the clinical finding. There are like a lot of discussions with regard to medication as well. For example, there's a medication that we call amitriptyline, which is used for backache due to sciatica pain, which is basically nerve irritation at the back. Now, what this study suggests, it's because it's one of the medication that's used for depression and low mood as well. A lot of additive factor of this medication while managing the sciatica pain is also because of the factor that it relieves the mental stress and kind of help in that particular aspect, and that usually helps with the pain as well. There are some important symptoms to consider if someone has got a backache, and if you notice any of the symptoms, it is important that you seek an urgent medical assistance. The important symptoms I would say first is if someone has got any changes in the sensation at their bottom part, which is their front and the back. If there's any different sensation, that is a red flag. If you've got issues with erection or changes of sensation at the vaginal area, that is a red flag as well. If someone sees that they are newly incontinent and they cannot control their poo or their pee, that is a red flag. If the pain starts shooting on the both sides of the leg, that is a red flag as well. If someone has got a direct injury at the back, that is a red flag. If someone has got fever or someone has got a cancer history, that needs to be brought up to medical assistance as well to make sure first there is no infection, and second, in case of cancer, there is no spread of the cancer. I hope this video is useful. I'm sure there is a lot of improvement that we can achieve while we're discussing backache, and I'm always here to listen to your suggestions and your experiences with regards to backache as well. Till our next video, take care.